Okay, hi there. Welcome to today's Open Mind session. My name's Harry Walker. Be doing some introductions for our guests today. Today's topic of conversation is co-production. So if anyone who's not heard about co-production, it's the idea of utilizing the experience and skills of service users to inform and guide what we do in AWP. And it's been picking up momentum in recent years, and it looks that we're going to be doing a lot more co-production going forward. So a great opportunity to hear from some people who have been doing some of that work. Like I said, my name's Harry Walker. I'm a mental health worker under Bain's Early Intervention, also a kind of research practitioner for research and development across AWP, and integrative counselor for Bath Mind as well. So a lot of different hats. But at the same time, I'm also have been a service user and continue to be a service user, and do my best to keep co-production going in and around my sphere of influence. So I'd like to just take a second to introduce our guests. So maybe if I hand over to you, Angelina, to introduce yourself.
Yeah, hi, I'm Angelina. I'm an expert by experience, and I've had experience of inpatient and outpatient services.
Cool. Thank you so much, Angelina. How about Tessa? We can get Tessa on to introduce herself.
Hi, I'm Tessa, and I've been involved in co-production for nearly 2 years. I have been a service user, and I'm also a carer. Thank you.
Thank you very much. And last but not least, Hannah. We can get Hannah on. Hi, Hannah.
Hello, I'm Hannah. I am a peer mentor for ASCC, which is Advice and Support in Custody and Court. I'm also a service user and peer mentor.
Cool. Thank you very much. So we're going to take some time to hear from all three of our guests. But before we do, I just want to give you a little bit of information about today. We're using Microsoft Teams, but a different kind of function of Microsoft Teams called Town Hall. So if you check up top, there's a little icon that says Q&A. So if there's any questions you'd like to ask anyone, you can type them into that Q&A, and we'll try and address them as we go. We'll also allocate a bit of time at the end to take a closer look. If there's any questions that might need a bit more of a kind of formulated answer, then we will try and take a look at those in a bit more detail, take some time, get some answers together, and then put them out through communications. The session today is going to be recorded, so we very much appreciate you watching right now. But if there's any if you have to get back to work for some reason, or anything that interrupts you from seeing us live, you can watch the recording later on onto YouTube. Okay. So first of all, I'm going to hand over to Angelina. So yeah, Angelina, if you'd like to take the floor and tell us a bit about what you've been up to.
Yeah, sure. Thanks, Harry. So as I said, my name's Angelina. I'm an expert by experience, and I've had experience of inpatient and outpatient services. My passions are creativity for wellbeing, and breaking down the stigma about psychosis and other mental health conditions, and raising awareness about complex post-traumatic stress disorder, how debilitating it can be and how it can cause other mental health conditions. I'm also really passionate about improving services with my lived experience. So the co-production means a lot to me. It's really helped me in a really hard time in my life. It's given me purpose and meaning for everything that I've been through. It's kind of like something positive at the end of a really hard few years with my mental health and finding a mental health crisis, which led to me being hospitalized. The way I started with co-production was about a year after I got out of hospital. My care coordinator asked if I wanted a job with the early intervention and psychosis team, like my mental health team. And I said, do I need an interview or do I need to apply? And she said, no, you can just have it if you want it. So I was like, okay, yeah, I'll give it a go. I had no idea what it was about. And then that started to be the highlight of my month. I'd look forward to it so much. And it really helped me regain confidence generally in life and just in work, because when not, general work would have been like too intimidating. And yeah, so when I also got the call to join that group, the peer support worker said that he said my name came up very quickly, which like really gave me a confidence boost as well, because I hadn't worked for ages since before. Like, yeah, I hadn't worked again since I'd had my mental health crisis. I've been signed off sick. So yeah, it really helped me generally with my confidence and my confidence in work. And then I joined like a distribution list, and I just obviously get sent a lot of stuff now from AWP, and I pretty much accepted everything. I'll put myself forward for everything, and pretty much got everything that I put myself forward for. So I'm doing about 10 different roles now, and which are regular. And then I've done like 5 one-off roles, which are like different types of training. So one of them, I was training at the BRI. I was training nurses alongside psychiatrists of how to work with mental health in acute medical hospitals. I also did an art in nature psychiatry day where we went into the woods with like art psychotherapists and psychiatrists and like, yeah, used creativity. I've also been interviewed by second-year medical education students so that they have experience of working with people with mental health problems. And I also did an International Nurses Day recently where I was teaching them, like about my journey into hospital, my journey in hospital, and my journey out of hospital. And I also did a one-off, it's called Choose Psychiatry Summer School, which I'll talk a bit more about in a minute. So yeah, so I would say they're the benefits for me, like regaining confidence with in general life and in work. Also, it's really nice actually, because I had psychosis and I was at Callington Road Hospital and in Salisbury. I felt like I didn't feel safe, and I felt like I was under like at risk of harm from the staff, and I thought the NHS ruled against me. So actually doing this work has helped me like meet people that genuinely care about the patients and like see that they actually do have people's best interests at heart, and that's been like really healing for me and helped me kind of process everything, because it's really confusing when you have psychosis because everything feels so real. But yeah, so I'd say it's kind of been it's been really like refreshing and healing, and really nice to know that people that work in mental health genuinely do care about the people that they're working with. So the benefits for AWP, I would say it's just so valuable to have lived experience, and I think it should really be shaping the service. And in my opinion, like somebody that's been in a situation and come out the other end is the person that can help someone the best, because then you can look back and think, what would I have needed in that situation which was lacking, which would have helped me to recover more quickly or have more of a successful recovery. So yeah, and I think that co-production along with practitioners is like the perfect mix, because it's coming from 2 very different approaches, but I think the knowledge that a lived experience representative or a person can give is just like invaluable and just so different to anything really. So I think it's kind of the best thing that so I think that's one of the best benefits is the impact that can have, like the knowledge of somebody that's been through that situation. I do a lot of training for AWP. So what I like to think is that when I train, say 20 nurses or HCAs or whatever, or OTs, that it's going to expand out to so many people. So so think about how many people all those practitioners will help in the trajectory of like their career. So like I like to think about that, because it just feels like it's going to have such a massive impact. And like I've done it a few times now, and every time I do it, I'm training more and more people. So it feels like I think that's a really big benefit for AWP. So like a bit about some of the work that I do. So I do a training at Callington Road regularly, and it's called Working Therapeutically on Wards, and I rap about mental health. I write raps about mental health and overcoming adversity and resilience and stuff like that. And I feel like they're an innovative way to share my story. It's an engaging tool and everything like that. So I was a patient there 3 years ago, so I'm so proud to be like training there now. I train with the head of psychology, Megan, and she said that my raps are just they're brilliant on every level to basically for the training, because it shows how healing can be found in like creativity, and also it's a really engaging and memorable training tool. So I absolutely love that training. I've done it twice now, and I'm going to be doing it again in October. And another thing that I did was, as I said earlier, the one-off Choose Psychiatry Summer School for 16-17-year-olds, and I did a presentation on there, and I incorporated a bit of my raps as well. And I feel like that was an amazing training, because it's kind of shaping the future of the workforce, and also it's kind of starting with young kind of teenagers, and also teaching them about mental health at a young age, which I think is really important. Another thing that I recently joined was the Strategic Service User Group, and I chaired the second meeting because the chair was off on holiday, and I'd like to throw myself in at the deep end, and I'll be chairing the next one as well. And then I'll be a co-chair for that going forward. And we had a guest speaker there who was a non-executive director, and also we had talking therapies and we interviewed them. And I just think that's such a great group to be a part of, because it's like strategic level, trust wide. We can ask people, we can get people, guest speakers to come, ask them questions, and hopefully like teach them a bit about what we do as well. Another one-off thing that I did was the International Nurses Day at Callington Road, and I did my presentation. I have like a presentation that I do kind of everywhere now with my raps in it, and then I kind of adapt it depending on where I'm training. So I do the same presentation, and yeah, so I did that training, the International Nurses Day for nurses at Callington Road, and I've got a quote from one of them. I got like a letter of feedback from all the nurses, from the matron, and one of the nurses said, "It is so inspiring and courageous, and the raps are so emotional. They touched our hearts. You now being an NHS professional is so inspiring to us." And I just thought that was like a really nice quote that kind of sums up, yeah, like how it's impacting staff members in AWP. So yeah, I would say like my experience with co-production has generally been amazing, and yeah, I've like learned a lot from it, and it's really kind of empowered me a lot as well. And like I said, it's helped me to heal in a way. There are some negative points as well, which I would say that sometimes there is like a power imbalance. Yeah, I mean, this hasn't happened often, but I'm sure like other people have felt like this as well. That's why I'm kind of bringing it up. And I felt at times that my opinion isn't counted, like the decisions have already been made, and then I'm kind of there, and it's kind of a bit tokenistic in a way. And yeah, so it's like, yeah, they just want you there. I felt like I'm just there for like just to be there, not really because they value my opinion. Yeah, so I think like just to be like staff members be aware to make sure that they are really including experts by experience and like taking their opinions into account and stuff like that. Another negative I would say is that there's no career pathway, because I feel like it's a great experience and you can do this, you know, for however long you want, but I just feel like it should be leading somewhere, because obviously it's great, but yeah, I mean, and I feel like experts by experience should have all the same benefits as other staff members. So the fact that you just do this and it doesn't lead anywhere, I just think that means that experts by experience aren't being valued actually, because yeah, they're not being treated in the way other NHS staff are. And you know, people say, oh, we really value them, and I do understand that is the case, but I do just think if we were being valued, then there would be a career pathway mapped out, and I just think this needs a lot of progression. So that is a massive negative point for me. So yeah, my final point is that it's been, the co-production I've done has been absolutely brilliant. I've met some amazing people. It's been really powerful, meaningful and empowering experience. It's helped me to process my own mental health crisis, and yes, kind of find the positives and use that to like implement training for other staff, to help them improve, and hopefully like for the greater good of the other service users. So yeah, I feel really proud about that. So that's yeah, that is probably my final point. I'd say I've had like a 95% positive experience. So yeah, it's been a pretty great experience. So yeah, that is a bit about my experience with co-production. Thank you so much for listening. Harry, back to you.
That's great. Thank you so much, Angelina. That's awesome. Really, really great to hear the benefits for you, you know, getting involved in that capacity, and then that knock-on effect, you know, training staff, all of the people that your experience is going to help influence. I think it's really, really important.
Yeah.
I think a couple of the points you made, you know, about I think the power imbalance and the career pathway point, really, really significant, something we really need to think about. In terms of that kind of career pathway, like, I mean, do you have any ideas about what we could be doing in order to make that clearer, or do you have like a message for any of the people that make those decisions maybe?
Okay, yeah, I do actually. So I just think like it's so important to implement co-production at every level of the trust. And also I think there should be some kind of training for experts by experience, because in my opinion, the lived experience is as valuable as, say, having a degree in occupational therapy or mental health nursing. I think it's just as valid and just as valuable. And I think there should be a way that people can become qualified as such, or, you know, be able to make it into a career pathway. Another thing that I'm doing is so I've kind of created pathways for myself. So I'm going to be mentored by the head of psychology, Megan, from Callington Road Hospital. And I'm also going to be shadowing Jenny Powell, who is the service manager for the early intervention team and North Bristol recovery team, which are both the teams I've actually been in as like, you know, as a patient. So I've kind of made them because I was talking to my care coordinator and she was like, why don't you do this? And then I've just kind of approached them and they've agreed to do it. So, which I'm so excited about. So I think maybe that's something that people should be thinking about as well, like more options for this, like start thinking with this expert by experience, who would be a good person to mentor them? Who would be a good person to shadow them so they can really hone their skills and build on their skills and eventually can lead to a career someday. So that's what I would kind of say. Yeah, implement a lot more of that. But I've implemented it kind of myself, and yeah, I'm really excited about it. But I think it should be, people could maybe think about that a bit more.
Now that sounds excellent. I think you're kind of trailblazing, setting an example for what could be done, and I think having your input on these concepts is really, really valuable. So
amazing, thanks, Harry.
Hi, Simone.
Hi, Harry. I just wanted to let you know we have another question that's come in for Angelina. So how does it feel working with staff after being in hospital?
Okay, yeah, that's a really good question. So like, for the most part, like I said, it's really quite healing and validating, and you know, it kind of makes me feel better to know that people genuinely do care about the service users and that they're, you know, do have the best interests at heart, because obviously it's very confusing when you have mental health conditions and you're in hospital. You can feel like everyone's against you or you're unsafe. So obviously that's been great. On another level, it is quite strange sometimes because I do see people that looked after me when I was very unwell, and it can just it's happened about 4 times now, and yeah, I mean, I kind of get more and more resilient to it every time. But yeah, so like, for example, I was in a meeting at Callington Road the other day, and there was somebody that worked in the PICU in Salisbury that just worked there for the year that I was there I was there for a month, but in that year, and he was in Callington Road because he'd just come back to work there. And because I was so unwell then, I was like, oh gosh, it felt worse than even seeing people I'd met at Callington Road, worked with me at Callington Road, because it was like at the very beginning. Obviously, if you're in a PICU, you're very unwell. So I was kind of a bit like, oh God, I don't know if what I was doing. If you saw me unwell, it can feel quite, make you feel quite vulnerable, you know, when somebody sees you when you're in a very different place to what you kind of were. But what kind of works for me in that situation is I get the person running the group or the session to facilitate a meeting with me and that person. And then I'm not wondering, is it them? And then it's kind of validating where I'm like, oh, they are a real person, it was them, you know. So that kind of helps. And also he said he didn't remember me, which I was so happy about. But you know, so it's kind of nice to, yeah, I think like to have that facilitated. I mean, it can be really, really nice seeing people as well. So in that same meeting, I saw like the lady that does exercise at Callington Road in the same meeting, and I went up to her because I knew her a bit better, and like obviously she'd seen me as I was getting a bit better, and she remembered me, and like, you know, she said it's so nice to see your growth. And like, it's really nice for her to hear. And I was like, you know, I was obviously really unwell with psychosis when I was working with you, and now I'm, you know, doing all this expert by experience work. So yeah, so I think it's really nice as well for staff to see the growth, because when you work in the hospital, this is what me and Megan, the head of psychology, have been talking about, is like, when you see, she said to me to talk about my growth and my presentation, because they love to hear it, because basically the staff, they only see people when they're really unwell, and then they discharge them and they hope they're okay, but they know nothing about them. So it's really empowering and nice, and makes them realize that their job is worthwhile. Like, yeah, when people come back and talk and they're doing well and they've got through stuff, it kind of gives them a bit of hope for the other service users and kind of inspiration. And yeah, it kind of helps them to know that what they are doing is, you know, worth it, and people do get better, I guess. So yeah.
Yeah, absolutely. You know, I think seeing people's lives improve and seeing things get better is massively motivating, I think, for everyone involved. So, cool. Thank you so much for your time, Angelina. It's been lovely to hear from you, and we'll hear from you again towards the end. Hey.
Yeah, thank you.
Cool, thanks. Okay, so now I believe going to hand over to Tessa. So yeah, Tessa, if you'd like to take the floor and tell us about yourself and what you've been up to.
Okay, brilliant. Thank you, Harry. Like I said, I've been involved with co-production projects for the last 2 years, maybe. But I've got to say, this is the one that's made me feel the most nervous. Before I was involved in co-production, I rarely talked about myself or issues that I was facing. I'm not used to talking in front of people. I have been part of many projects, which have been things such as delivering training, care awareness training, facilitating confidentiality workshops, supporting on away days, being involved with interview panels and interviewing staff for future jobs, which I have found really great. Over the last 2 years, the project that I am the most proud of is being involved with the Triangle of Care. Before I was involved with co-production, I had been a carer since I was a very young child for various members of my family, but I did not know that at the time. So becoming involved with co-production, I have for a start realized that I was a carer, and that has led me to be able to advocate for people like me who were never identified as being such. And since then, I've been able to deliver training on the Triangle of Care, and I share my personal experiences of what sort of things I've been through, the opportunities that might have been missed, where if I had known that I was a carer, I could have involved myself with of support services that I'm now aware of. I think I could have advocated for myself and my family members a lot better. I have so much more knowledge now that that I would have been able to use. So when I'm delivering training, I talk about this, and for me, it was like one of the first times I've ever talked to anyone really about some issues. Even my friends don't know as much as I've talked to complete strangers about. Doing that has really meant a lot to me. It's letting members of staff know about carers and what their role are, what the role is, and what sort of issues they're facing, how they can have multiple issues at the same time, what it feels like when you're, you know, engaging with services and the power dynamics. And while being involved with the Triangle of Care, I've not only delivered training, but I have been involved with the audits of the Triangle of Care, which have been with all community teams of AWP. And it has been really great seeing from one assessment that they've done, one audit to the next one, like changes in the services. I've got to hear everyone talk about how they see carers, and so many people. It's just been fantastic to hear how they incorporate working with carers into their work. And some other places don't as much, I have found, but it's also been really nice to be able to explain things that they are able to do that would involve carers more, and to share the knowledge between teams. And I also think as being involved with co-production, you really do get an opportunity to be part of so many things that you can spread the knowledge and information that you hear in one place to another. And I find that really useful. Yeah, I've been training the preceptorship nurses on the Triangle of Care, like I said, all the recovery and crisis teams, and I really do believe that's made a difference. It has helped me with connections with staff. I was aware of the power dynamic I'd felt before with staff, and I assumed that those who were working in mental health services do know more than me, or they are professionals and they know everything, but actually they've not always had first-hand knowledge of the experiences of people like me, carers like me. And I think even when they do know some stuff, I think it sort of hits differently when somebody is in front of them telling them what has meant the most to them and what has really affected them. And sometimes it might be things they hadn't even thought of. I also help promote carer awareness by doing confidentiality workshops. The confidentiality workshops were co-created by carers and service users and delivered by carers and service users, and I've been really proud to do that. I've done lots of fun things too, like hosting carer event, supporting AWP at events such as Eastern European Family Days and all sorts of things. I've also, with the Triangle of Care, seen how the Triangle of Care works not just within the NHS, but also with private hospitals such as Signet Hospital. And in the community services and inpatient services. And I really just admired the passion that I've seen from members of staff and the way they talk about carers, and they really try to make carers' voices heard and improve services going forward. Personal benefits to me of co-production, I could probably talk about for 3 hours, so I won't, but I will just say that before I'd started, my confidence was very low. I barely leave in the house. It took me 4 years before I actually began co-production activities because I really didn't feel like I would be of any use to anyone. So my personal benefits have been the skills I have learned, such as public speaking and yeah, like I said, social skills, connecting with people, that sort of stuff. But also my self-esteem has really improved. I really believe that I am and have been useful in places where I have been. I was nominated for Involvee of the Year, and that really meant a lot to me. I wasn't so much caring if I would win or not, but the nomination was a complete surprise, and it sort of just listed out the activities that I do, what others have felt and gained from that, and that was very special to me and really gave me confidence to just keep going, really. Since doing this, I've just learned so much, which hopefully will help improve services, but also helps improve my ability to advocate for my family members that are still using services and to advocate for myself. I feel like I understand them more, the situation that they're in. I also feel like I could advocate for AWP to anyone. I feel like I could convince anyone that actually maybe going to hospital would be absolutely lovely, because some of the people are so great. And like week after week, I could see all the improvements and the changes that are being made and the passion from members of staff and the kindness. And for me, I really love that. I like seeing how people work and the professionalism, and I notice little things and I think, oh, I wish I was a bit more like that. And I get to learn from such great people. I felt supported and valued. And it's been a great experience for me. And the only negatives I could really say that I've experienced is just difficulties faced when carer commitments sort of bump up with the work I am working on, I'm trying to do, because sometimes it's a bit hard when things are not going so great in the personal workings with mental health services, to still have that drive and feeling that you still want to be involved and you still want to help improve things. And also, I just have so much regret and sadness sometimes that I didn't know what I know now. For example, when I was looking after my grandmother who passed away a few years ago, because I really believe that if I knew then what I know now, that I would have been an even better carer for her, and I would have accessed support for myself, which in turn would have helped her as well. Yeah, but thank you very much for listening to me, and enjoy the rest of the talks. Over to you, Harry.
Thank you so much, Tessa. It's really, really heartwarming to hear about your experiences. I think it's really resonated with me when you're talking about, what you've learned and what you wish you could have implemented in the past. But the fact that you're now in a place where you're helping other young carers to kind of have that knowledge and to know those things that can make life a little bit easier in very difficult circumstances. Yeah, really, really valuable. I wonder if you could just, tell us a little bit more about your kind of carer perspective. You said about within your family, there's been multiple people who have been affected by mental health, and a bit about how you take care of yourself and how you take care of them, and a bit how that works in practice, I guess.
Yeah, well, like I said, I've been a carer since a young child for my grandmother, first of all, who had schizophrenia. Because just got to say, my grandmother was the best person I'd ever met. Her schizophrenia did get quite bad. I lived with my grandmother, because she got sectioned. I was moved to Bristol from Cardiff, where I was born, and I just had it just affected every part of my life, really. My education, I missed 5 years of school. Even more recently, I was homeless for 2 years with my son between the ages of 12 and 14. And this came about, I was just overwhelmed with the stress of, at the time, it was my brother who was in specialized services. Well, he's in specialized services now, but he had been going through a lot. He, attempted suicides, that. The lack of information that I had then really, I don't know, disturbed me so much that I ended up shutting off from everything, and I didn't feel like I was able to deal with things. But now I feel a lot better to deal with things, and it's helped me with my relationships with my family members. My mum is a user of services, and my brother is, and they're also what I would say is the kind of people that are hard to get through to. So it's been sort of a difficult relationship with services, especially when they have entered hospitals mostly because of through like the criminal route, where they've gone to prison, and in my brother's case, and then to hospital. So for me, I always carried a lot of mixed feelings about services, about my family, and I really struggled, and it affected my mental health. And it's taken me quite a few years just to look at myself a bit differently, feel proud of myself for all that I had done, and not to feel the shame that I felt, that I never felt I was doing enough. Where I'd missed so much school, it really affected me, and just lots of different ways. But at the moment, I'm here doing this work, and I love it, and I feel like I'm really making a difference. And at home with my family, which is me and my son mainly, my son is so proud of me. In fact, I have his little picture above my webcam right now, just so I'm just talking to him, and just knowing that, I don't know, yeah, things are a lot better now, and it could have been so much worse. Thankful for all the people that have supported me, my carers, the services, strangers, and I just want to share some of that going forward.
Wonderful, Tessa. Thank you so much for sharing. And I think it sounds like you've been working really, really hard to get yourself where you are today. So yeah, well done. And thank you so much for your contributions back into services. Really, really great. Thank you so much. Okay. Simone.
Hi, Harry. Angelina had a question for Tessa. Angelina, I'll just bring you on screen 1 second.
Thank you. Yeah, Tessa, I was just wondering, do you find that you're treated differently, like when you're doing expert by experience work as a service user or a carer? Because I think you've got a really unique perspective from like doing both. I'm just interested to know.
I think maybe yes, there is a difference. I think that is more so from the fact that when I am a carer, some projects where I'm there as a carer, I share my personal experiences more, which I don't really do as much as when I'm working as a service user. When I do the carer awareness training and I talk about my story, which that's part of my story because it's different every single time because there's so much I could say, but it's different then because I've opened up a lot more and staff open up a lot more to me. I mean, I remember one of the last times I did care awareness training, which I had done quite a few times, but just in the middle of it, all of a sudden I just started crying, which was just completely unexpected. And I was with such a lovely group of people, but there was staff there that were crying as well, and it ended up just being a room of everyone crying a little bit and sharing their experiences. And yeah, I think a lot of staff tell me that they've related to what I've said as a carer and talk more about their personal experiences as well, more than when I'm there as a service user.
Thank you.
Cool, cool. Thank you very much, Angelina. And yeah, thank you again, Tessa. Much appreciate, and we'll hear from you again towards the end.
Thank you, Harry.
So I think last but certainly not least, we have Hannah. So Hannah, if you're up for telling us a bit more about your peer mentoring and other activities.
Yeah, definitely. So I have been volunteering as a peer mentor for advice and support in custody and court. So it's the criminal justice system side. I got into that because I've suffered my whole life with mental health. And I've been involved with many different services, but the one that got me into the peer mentoring was I actually had to attend court myself, and I received the service from ASCC. And with that, it was nearing the end of the support that I needed. So my court case was coming to an end, and the gentleman there who then became my boss, asked me whether I'd thought about doing volunteering, supporting people who have been in the same sense. And I asked him if he knew who he was asking, because I'm all kinds of crazy. And his response was, "That's what will make you great." And I didn't believe it at first, but having completed the 3 years, I can say that I absolutely shone with it. It's brought me out of myself in ways that even I can't comprehend. The difference from where I was to where I am now is complete day and night. So with the service itself, when I was using it, I was going through a particularly hard day, and I'd rung up in a bit of a state, and someone said, "Oh, I know how you're feeling." And I was like, "Well, no, you don't," because my experience of when people have told me that are people that have had no knowledge except for what they've learned from books and things like that. So I was like, "No, you don't." And she didn't go into all the detail. Apologies for the wind. But yeah, she didn't go into a lot of detail, but she kind of skirted around her involvement in the fact that she was a volunteer and an expert by experience, which was the first time that I'd actually come across that term. But it is absolutely fantastic, because when I was young, there was nothing where there was co-production or expert by opinion experience. And to have someone who may not have gone through exactly the same thing as me has gone through similar, it just gave me hope, to think that maybe I can get to that point, and it has. I am now at a point where I actually have confidence in what I do for the first time in my life. And through that, I've kind of got a lot more opportunities as well. So I have helped organise a celebration day, which was a couple of months ago. And with that, it was for volunteers, involvees, and service users. There were staff there as well. So it was a whole bunch of people and kind of experiences and things like that. And that is the one thing I love, is that we're all, regardless of our backgrounds, we're all there for the same reason, to help people. I've also kind of, like Tessa, I've sat on interview panels. It did go to my head a bit, because I was like, I have the power. And then I have signed up for co-facilitation for confidentiality workshops. The opportunities that have arisen from doing the co-production does seem endless. There's always something that you can sign up for, and it does help it's helped me immensely in my own recovery. So it's been fantastic. And another term that I never kind of put towards myself was, in recovery for me, it was like drugs and alcohol. And with myself, it was mental health. And I never kind of foresaw my journey as recovery. But yeah, it's given me a lot of knowledge that's been able to help myself as well as being able to help others. So I think it's fantastic. And that's, I'll hand you back, Carrie.
Cool. Thank you so much, Hannah. Really, really great to hear about your work you're doing within the peer mentoring and your involvement work. Everything. Thank you so much. It sounds like getting involved in the peer mentoring has been really transformative, and I think about the way that your personal difficulties that you've experienced, being able to turn those around into a strength, into a positive influence. That seems it's been a very transformative experience for you. Would you agree? Yeah.
Oh, most definitely. As I said, I've had mental health from a child, really, and I've used many different services. I was an inpatient for quite a few months. And for me, it's having that knowledge and understanding that there is hope out there, because for years, the mental health services would say, it's always going to get better. But my argument was, I know that it's going to get better, but from historically speaking and the past experience, it's always going to get worse. And I never felt that I would ever be able to get out of that situation where, as I said, it does get worse, it gets better, but since doing the peer mentoring, I haven't had any I've had setbacks, but we're all human. But the knowledge and the recovery that has come through that has made me able to better deal with situations that would normally have derailed me historically. So yeah, I can't thank everyone that I've had the knowledge and learning from. I cannot thank them enough.
Yeah, that's awesome. Really pleased to hear how helpful this process has been for you. But again, hello, Simone. Yeah.
Hi, we've had another question come in, which is for Hannah. What has been the most rewarding and the most challenging aspects of being a peer mentor?
The most rewarding. So there was one occasion where, obviously, as I mentioned, I helped do the celebration day. There was also an occasion as well. I'll try not to go into all of the positives because there are so many. But there was a kind of event where it was looking at how the NHS and AWP are progressing the peer mentors lived experience people and how they're training them. And I actually helped put together the proposal. And it was fantastic because we actually won gold standard. So that was amazing in itself. I've also co-produced a document regarding equality, diversity and inclusivity in digital practice, and I'm getting my name published for that one. There haven't been, in my experience, there hasn't been a lot of negatives. There was some when it was regarding peer mentors attending a staff meeting. And this is just a third person experience, but was made aware to me. And they felt that we shouldn't be there because we're not paid staff. But then we were kind of informed that that had been dealt with, and the person that said that had obviously had things explained to them and the importance of what we do. So that's the only kind of negative, I find.
Okay. So there's something there again about trying to have everyone on a kind of equal playing field, you know, to have our service users and staff try and see each other as human beings and not with those divisions in place.
Yes,
Yeah.
definitely.
Okay. That's great. Well, yeah, thank you so much for your time, Hannah. Really appreciate you being here,
Thank
and
you for having me.
yeah, have a wonderful camping holiday by the looks of it. Yeah. Um, cool. So I'm going to talk a little bit about my own experience. I think having that progression from service user into staff is a great example of where co-production is being effective. So I was a service user under the Baines EI team. So I now work for the team that took care of me, which is quite a unique position, doesn't come up very often. And I remember when I first met the psychiatrist at the time, Dr. Stanton, one of the first things he said to me when I met him was he thought I would be a good fit for working in services. And everything else just seemed to sort of fall into place over time. I did the peer mentoring again, working closely with Baines EI and working with people who had experienced psychosis, as well as other service users outside of that team. The involvement work again, sitting on interview panels, really valuable for getting to know the AWP systems, the various levels, various different departments that keep everything running, and meeting people from a whole broad range of backgrounds. You know, I sat in on the CEO interview, like a whole day event, sitting in on that, down to healthcare assistants and band threes and band fours, and yeah, I get really getting to understand how mental health services function. There was also under involvement, really wonderful creative projects where they linked us up with people who work under corporate facilities or in finance. And again, that was really valuable. Like formed this relationship with one of the corporate members of staff, and that persisted. You know, we'd see each other and we'd catch up, and it was a real pleasure to see people in that regard. And again, I felt that I was treated very well, treated as an equal in many ways in that capacity. Also, we've mentioned a little bit about the strategic expert by experience group. I was there involved in that group when it first formed. I'm really pleased to hear it's still going. Again, I think it's a real model for how we can get service users involved on every level of services, even on that strategic trust-wide level. Really valuable. Bit about how I got into work. So the first job I had was in the research department, working on a very specific research project being run by Oxford through our research and development team here. So I was hired as a service user researcher, now a lived experience researcher. And yeah, was given that job on a part-time basis, and from that learned tons about the research world. I was delivering a form of therapy, so learned tons about therapy, which has been very useful for me going forward. I really can't thank the R&D department enough for what they've been doing. I think they're really setting a good example about how service users can contribute and get into professional roles. It's continuing. And we got one of Baines EI's own nurses, Mark Batteram, who's now developed his own research project, and again is giving opportunities to service users to progress in their career. One guy, Harry Dyson, ended up working for the McPhinn Foundation in London as a researcher. You know, it was really amazing career progression into a really valuable team that does lots of good work across the country. Yeah, and then through that, I maintained that contact with Baines EI. Still, those relationships were strong. They treated me very well, very respectful, and so contact with them maintained. And when a job came available, they let me know, and I went through the proper channels, through track, and was interviewed, and yeah, it felt like everything kind of felt it was done appropriately, not tokenistically, I guess, is what I would try and suggest. So again, a huge big thanks to them. And it's an interesting dynamic, but it works well. And it gives me a lot of opportunity to use my experience to help other people, which is, that's the real motivation for me, for sure. A little bit about, what I'm trying to do in terms of co-production with service users at the moment. We have put together a peer support group, kind of psychosis discussion group through involvement, which is supervised by staff, but is attended by involvees. Everyone signs up for involvement. And we have some people who are kind of peer mentor type people who have had some training. They're a few years further down in their recovery journey. And they're people I've worked with for a long time, that I've known for quite a long time. And we bring them in, and we bring in some service users who are a bit earlier on in that recovery journey. And we just try and make it very, very like an equal atmosphere where everybody is giving their own contributions. Even if we have staff along, I'll be there. Everyone is speaking in the same manner. Everyone is invited to share on the same topics, and there's no preferential treatment in any direction. And I think, for me, it's been a really wonderful emotional experience to see the benefits that everyone's getting out of it. Really, it makes me feel really good about the work I'm doing. I think the mentors, they have a real sense of purpose. Again, turning those difficult experiences into strengths that benefit other people, really valuable. And for the service users, to not feel so isolated, to feel that there's hope out there, which I think is what we've heard about today. Really valuable. A little bit about, I think, why co-production is so important. Service users, they come with all kinds of different skills and experience and knowledge, and we really need to start valuing that as much as we can. People who have had a positive recovery journey, are very motivated to give back to services. We see that a lot. People who may have had a difficult time, they can be motivated to make more improvements to services. And I think people who have experienced serious mental health issues, it gives them an understanding of mental health that is very, very hard to teach, if not impossible to teach. And staff in AWP, I think, have got the best intentions, and people can study for years in order to provide the proper support for people. But it's I think that the internal subjective experience of serious mental health is just something that's not reproducible in any other capacity. And so we need to really value that resource of service users who want to give back and who want to use those experiences to improve and guide what we do in AWP. Really, really important. And also, having input from service users on every level, I think, is only going to make us more empathetic. If we have those people who are next to us as we're working and as we're making decisions, I think it's a constant reminder of why we do what we do, and that we need to maintain empathy for the people that we're trying to take care of in very difficult circumstances often. There was a little bit of mention about power imbalance. I think it's another point that's worth addressing. I work in clinical services. I see service users every day, more or less. And when you're in a supporting role, there is certain considerations into how you interact with those person. There's rules about boundaries and confidentialities, a lot of different safeguards that are all in place in terms of how we work with people. And that can create a bit of a kind of us and them dynamic, I think, which is necessary in some ways, but in other ways, maybe not not the most doesn't promote equality in the best way that we would like it to. And just being aware of these things, I think can help to break down that barrier in other ways. So still, as time goes on, it feels that with involvement and co-production, these things are getting more and more. There's more and more awareness for those kind of problems, and yeah, just to a reminder to any staff that interact with service users, especially in co-production, that we're all human beings, and we should all be equal, and all respect each other and respect each other's skills and experiences. Feels that with this 5-year strategy going ahead, that co-production is going to increase, and I think there's a bit of a cultural shift among staff that has been gaining momentum, but we need to keep that momentum up and ensure that we're utilizing our service users' skills and experience for the better of all of our service users, all of our staff, and all of the services we deliver. And also, yeah, about that idea of career progression. Some departments are doing more than others. I think maybe there's room for a peer workforce, like an allocated budget to hire peer service users into roles, understand their skills, and deploy them where appropriate. And I try and develop contracts and make that career pathway more clear for people. So I feel like I've been very lucky with the route that things have taken, and yeah, very much enjoy my time now, and yeah, looking forward to the future. So right, I think that's probably enough for me. I think we may have a few questions that have come through. Maybe we could bring everyone back. Oh, hello, Simone.
Hi, Harry. We do have a question that's come in from Megan. It says, do you have any suggestions about ways to get people into involvement roles so that we have a large and diverse range of people who have lived experience, who can contribute in the amazing ways that you've all described?
Yeah, I mean, I can take that question if you like. I think we need to just make sure people are aware of the opportunities and the different things that are happening. I think there's a bit of compartmentalization within services, like the strategic group, for example, is something I've been aware of for a long time, but maybe a lot of other people aren't aware of. These opportunities for training, all of the things that all of our guests today have been involved in. I think making sure that services are promoting these activities to our service users. We can get very caught up in fixing all the problems and then not offering more opportunities for people to kind of take a different journey. For sure, with the work I've been doing, I work quite closely with involvement, signed up a lot of people for involvement recently. And yeah, those things kind of snowball, I guess. Maybe being creative about how we utilize like things like involvement, what kind of projects can each individual person or team, what can they come up with that might be engaging for service users in a different capacity where they're able to give something back. So yeah, I think promotion, communication, and creativity for sure is a great way to do that. Okay, so it looks like we've covered a lot of ground today. I think we're pretty close to the end now. I'd just like to invite everyone back on to give a few final thoughts from today. Angelina.
Yeah, what I would say is that it's just really important to incorporate co-production through every part of the trust. Also get creative with it as well, because I think that makes for a really meaningful type of co-production, like with the raps that I do in the training. I think it just gives it another element. And also, like, it's extremely beneficial for experts by experience. So I think like the trust should work on getting more people involved, because it's really definitely had a really positive experience on my general like well-being and life. And also the final point I would say is like there definitely needs to be a career pathway developed or some kind of progression, so that experts by experience feel like they're being valued and all of the work that they're doing is leading towards something. So yeah, that's what I would say. Thank you.
Thank you so much, Angelina. Yeah, really great. Hi, Tessa. Have you got any final thoughts for us?
Just again, I would like to say that co-production is a valuable tool, and when we do work together, we can make amazing things happen to the benefit of absolutely everybody. and I just hope it continues more and more in the future, and I'm excited to see where it goes.
Yeah, and me too, Tessa. Yeah, really, really good stuff. And Hannah, we get you on. Have you got any final thoughts to share with the audience?
It would just be to kind of increase and grow with the expert by experience, making people aware of all of these opportunities, even if it's the case where they're not part of the hub involving making sure that other members are also aware of this. So yeah, just promotion and giving people a voice that wouldn't normally have a voice.
Excellent. Thank you so much, Hannah. So I think that just about wraps us up. Just about within time, I think. So thank you very much for your attention. If you're watching this post the live recording, then yeah, please send any questions through. I think we have the right email address, awp.communications@nhs.net. And yeah, thank you very much. Thank you very much to Matt Rees and Sue Woodland, Simone Matthews for putting everything together. And again, thanks to all of our wonderful speakers for today. Okay, goodbye.